Thanks to the organisers for inviting me here this morning. It's a pleasure to be here in Ottawa with you. And I'm going to speak about non-communicable diseases in Latin America and the Caribbean, a role for partnerships. Now, as you know, the NCDs, represented by the red aspect of the bars, are now the major cause of ill health and death in the world. And our region, the AMRO region, is really no exception. Both in men and women. They actually are a total of about 58 million or so deaths back in 2008, and 63% or 36 million deaths were due to NCDs. In the Americas, the majority of deaths are due to NCDs, as I said before, over 75%. And the important thing on this slide is that 42 or so percent are premature deaths. They take place before age 70. This slide shows some of the facts in the region. There are approximately 150 million smokers in our region. This extends from Alaska quite through to Argentina as I visualize it. About 30% of adults have elevated blood pressure, and 25% of individuals aged 15 years and over are obese. There are about 200 million people living with an NCD in the Americas. That's roughly 1 in 5. Total of 4 million deaths in the region, and 45% or nearly half due to cardiovascular disease, 30% due to cancer. Now, this is going to cost us. If nothing is done between now and the year 2030, we're going to lose about $47 trillion in lost income globally. What are the NCDs? We characterize them principally as 4 diseases: cardiovascular disease, cancer, chronic respiratory disease, and diabetes. And they have interlocking and common risk factors, namely tobacco consumption, harmful use of alcohol, unhealthy diets, which we heard about this morning from the minister, and lack of physical activity, which again the minister spoke to very eloquently in her presentation. What has been the strategy? I'm sure you're all aware of the high-level meeting on NCDs which took place in New York at United Nations in 2011. And this is really the first time that there was a global meeting on NCDs. The only meeting that took place before in this area was on HIV in 2000. And basically, this then led to action. There was a WHO Global Action Plan on NCDs, which has set a total of 9 global targets, which I'll speak to a little bit more, and 25 global indicators. In our region, we have the PAHO Regional NCD Action Plan, which is fully aligned with the global WHO processes. Coming out of the meeting in 2011, there will be a review of progress made by all countries of the Americas, and this takes place in New York at the United Nations General Assembly in July of this year. So we're going to monitor and see what the countries have actually done to make a difference in terms of processes, policies, and actions to reduce the burden of NCDs and their risk factors. These are the 9 global voluntary targets set by the World Health Organization. And the ultimate idea is that we're going to reduce mortality from NCDs by 25% by 2025. The idea is to reduce the harmful use of alcohol by 10%, reduce physical activity by 10%, also reduce salt intake. And this is actually quite important. Reduce tobacco use by 30%, reduce elevated blood pressure in our populations by 25%. We wish to achieve no further increase in the prevalence of diabetes or obesity in the Americas. Keep it at 0%, where it is right now. We also wish to improve drug therapy and counseling by 50% in the Americas, as well as coverage for NCD medicines and technologies by 80%, with the objective of reducing mortality by 25% throughout the Americas. And this is actually, these are global targets beyond the Americas. Our PAHO NCD Plan of Action speaks to tackling the 4 NCDs, the 4 risk factors, in addition to strategies to take on obesity as well as mental health issues, and particularly chronic kidney disease, which is a unique problem in Central America. We see NCDs as a development issue, and aligned with that is the need for whole of government and whole society approach, which speaks again to the importance, the key underpinnings of successful partnerships. Now, coming out of the high-level meeting in 2011, The Article 3 reads, "We recognize the primary role and responsibility of governments in responding to the challenge of NCDs and the essential need for the efforts and engagement of all sectors of society to generate effective responses for the prevention and control of non-communicable diseases." And that was actually the first statement of the political declaration of the high-level meeting. Articles 34 to 42, in summary, speak to the need for whole of government and whole of society effort. So it really highlights the importance of partnerships. Who should be involved in multi-sectoral efforts? Slide says it there. Every single component of the private sector and the public sector. We are all engaged. This affects each and every one of us individually. Who are the stakeholders? You, me, communities, individuals, families, institutions. And the lowest box speaks to private sector and industry, where and as appropriate. Everyone is not invited to the table. Most are. We will not do business with alcohol, tobacco, nor firearms. So what have we gained from the high-level meeting? We've gained political commitment. There's increased accountability. We have included other sectors. Before, there's a model of health supremacy. There's no coordination of efforts. There's mobilization of resources. I'm afraid not enough, but there has been some mobilization of resources. And there's a significant increased awareness of the scope of the problem. And these are all beneficial outcomes of the high-level declaration. Now, there are recommended NCD best buys, and they tackle tobacco use. And the way we tackle it is to recommend raising taxes on tobacco, protecting people from tobacco smoke, warning about tobacco, and enforcing bans on advertising. Alcohol, there are other strategies such as raising taxes, etc. For unhealthy diet and physical inactivity, we particularly are engaged with reducing salt intake through changes in food processing. We want to get rid of trans fats, which are not needed, which are not natural, and we want to promote public awareness about diet and physical activity. We also have particular strategic targets, those being cardiovascular disease and diabetes, and we also are trying to tackle cancer, particularly hepatitis B immunization to prevent liver cancer, which is quite important in the South American region, in Latin America, and screening and treatment of precancerous lesions for cervical cancer, which again is a tremendous preventable burden of disease throughout Latin America, which is not so much of a problem in this part of the world. Partnerships in action. This is now a strategic focus of the Pan American Health Organization. The gold standard for how partnerships can achieve outputs is the tobacco control. And this is a supranational treaty, possibly supernatural also, in terms of what is actually achieved. And this is a binding convention, which has been ratified by 176 countries, 29 in the Americas. You notice that the United States has not ratified it, but in spite of not ratifying it, they don't ratify these international treaties. They have actually enacted much of the policies and the strategies which are embellished and underpinned by the Tobacco Convention. And this has made a tremendous difference to the well-being of many populations in our region. In fact, the cigarette is probably the most significant preventable cause of premature death in the Americas. There are no safe limits to smoking. This is a strategy, the Empower strategy. And to do that, it required input from ministries of foreign affairs, ministries of health throughout the world, the collaboration of United Nations task forces and agencies, legislature, judicial branches, etc., etc., etc. And this achieved a major paradigm shift in tackling NCDs. But even while we have achieved it, the efforts made to roll it back. The tobacco companies have started to sue on the basis of investment. And if they win any of these battles, it will roll back much of what we achieved in protecting the public health. These are some of the work that we've been doing in the region in terms of chronic care passports to improve patient care throughout the Americas, and there are many other efforts to improve well-being of our population in terms of cardiovascular disease. We have also adopted new ways of working together. The Pan-American Health Organization actually, in collaboration with the private sector and other agencies, created the Pan-American Forum Against NCDs, PAHO-NCD. It includes the public sector, civil society, the private sector, academia, and international agencies. What's its purpose? To promote dialogue, to stimulate an appropriate environment to address the epidemic, to strengthen or to establish collaboration and partnerships to take action on selected priorities, to create synergies and address underlying risk factors for chronic diseases, making the healthy choice the easier choice. We also play a role in supporting member states in implementing the regional strategy and related mandates of the Pan-American Health Organization, and we also promote and scale up successful practices. These are some of the initiatives that we have taken on board as our initial priorities. Tobacco control, being active, working healthy. A grain of salt goes a long way, and this has been one of our particularly successful initiatives. And in fact, we have a tremendous buy-in from our Canadian partners, people like Noncommunicable, etc., who've really done a lot to push the reducing the salt in food agenda. And has actually led to legislation in the Americas. Argentina has now legislated the amount of salt that can go into bread. And these are bold initiatives that are going to be world-changing. Scaling up access to cardiovascular treatment, the sweetness of confronting diabetes, communicating non-communicable, women and cancer, a joint commitment to save lives. As I said before, we lose almost 70,000 lives a year in the Americas, in South America in particular, and Latin America, from cervical cancer. This has become one of our priority areas. This has also been a very successful program through the PAHO-NCD. A little bit about salt reduction and trans fat elimination. And we've also had health promotion activities, promoting physical well-being. And as you can see in the middle, if I can see it well, middle slide, we see people cycling. The cycle VS has caught on in a significant way in Colombia. There are also the capacity for people to walk in the wide boulevards on weekends. They're closed to traffic. So the whole idea of being physically active has caught on tremendously in South America and is actually now spreading virally into other regions of the Americas. Training, a very key part of our mandate. And we do this through the Carmen School, which is a virtual online campus where we engage focal points in ministries of health throughout the Americas, particularly in Latin America, and we also bring on board other strategic partners. However, it's not all smooth sailing. There are roadblocks and there are bottlenecks. It's a paradigm shift. Before we had this concept of health supremacy, we medicalized the approaches to NCDs and other disease processes. Doctors knew best. We were the experts. We didn't need to talk to anyone else. We said to do it, you did it, you got better. That's not the way it is anymore. So trying to get people to recognize there are different roles. We have to sit at the table. We have to collaborate. And I think I learned one lesson already for the morning from Rick. You don't need to be engaged indefinitely with your partnerships. Thanks, Rick. You can divorce people. Before, I've always thought about partnerships as being like a marriage. But, Rick, thank you. There are real and perceived conflicts of interest. There's lack of trust. When you sit at the table, you want something, your partners want something. It may not necessarily be the same thing. How do you negotiate those challenges? Lack of clarity on inclusion of the private sector and civil society, a problem we face all the time. We ultimately are accountable to our member states. Misinformation of media and by journalists. And of course, the old chronic problem, lack of resources. So really in summary, NCDs is a shared responsibility. The fight against NCDs is not only about individual choices. We have Best Buys is working for tobacco control, and we think that model, that Supernatural's supranational model can be extended to the food, the beverage, and the alcohol industries. Perhaps that's where we need to go with this thing. The multi-sectoral approaches are really the only way to effectively tackle the NCD epidemic. The PAHO NCD offers a unique opportunity for implementing a whole-of-society approach in the region. Thank you for your attention.